Hello, welcome to my channel. This video is the second part of the previous video on Neonatal Maladjustment Syndrome. So if you missed that one, you can find the link here on top, as this time I'm going to speak about treatment. Fluid therapy may be necessary if the foal is not nursing correctly. However, overzealous fluid administration is contraindicated in animals suffering from ischemic encephalopathy, as it may increase cerebral edema. Furthermore, sodium replacement fluids are not suitable for maintenance in critically ill foals because their kidneys are usually unable to manage an excess of sodium. Hypokalemia, secondary to hyperglycemia, may be seen during the use of parenteral nutrition. When that happens, potassium supplementation may be required. Non-invasive blood pressure monitoring together with data on clinical hydration and urine output and specific gravity may be the most accurate way of determining fluid status in neonates. Although neonatal maladjustment syndrome alone is not an infectious disease, recumbent foals are at high risk of infections and sepsis, thus the use of antimicrobials is justified. Plasma transfusion may be useful both in case of failure of passive transfer of immunity or if there is hypoalbuminemia secondary, for example, to gastrointestinal problems. Seizures should be controlled because they result in increased demand of oxygen in brain and muscle tissues, further adding to the hypoxic insult. Diazepam and midazolam have a rapid action, but their effects are of short duration. Phenobarbital can be used to control and prevent seizures, but abrupt cessation may result in resumption of seizures. Therefore, it may be prudent to gradually decrease the dosage over 24-48 hours. To avoid cerebral edema, it is important to correct electrolyte deficiency. Manitol has been historically used to lower intracranial pressure. It's an osmotic diuretic that pulls fluid out from the brain, but should be used with caution in case of kidney problems. Magnesium sulfate is an NMDA receptor antagonist, and NMDA receptors are stimulated by glutamate and mediate the influx of calcium into the cells. An excessive accumulation of intracellular calcium is responsible for the death of neurons. Ketamine is occasionally used under the same principle of blocking NMDA receptors. However, the use of NMDA receptor antagonists in foals have given unclear results, and in human medicines they seem to be effective only if administered prior to the hypoxic insult. DMSO is a scavenger of free radicals and may also reduce inflammation in the brain. Vitamin E is a major antioxidant in the lipid environment, thus reduces the lipid peroxidation in affected organs, but it takes up to 3 days to reach therapeutic levels. Vitamin C is a major antioxidant in aqueous environment, and it's thought to have also a neuroprotective effect. Many of these foals may benefit from intranasal administration of humidified oxygen, especially if there is concurrent cardiorespiratory compromise. Blood gases provide useful indication of oxygen status of the foal while recumbent, and maintaining foals in sternal recumbency has been shown to increase partial oxygen pressure. Anyway, by the time the oxygen therapy is instituted, it's usually too late compared with the time of the hypoxic insult, and in human medicine is now no more used in this type of patients, as it can cause retrolental fibroplasia, that is thought to be caused by disorganized growth of retinal blood vessels due to the hyperoxygenation. This may result in scarring and retinal detachment that may lead to blindness. Period of apnea, either secondary to phenobarbital administration or following the hypoxic damage to the respiratory center, can be treated with methylxanthines. However, overdosing can cause increased central nervous system, myocardial, and gastrointestinal stimulation. In case of severe respiratory depression, mechanical ventilation may be required. In case of hypotension, inotropes can be used but their need has been associated with poor outcome. A squeeze procedure has been described by Madigan and colleagues to mimic the neuronal reflex that occurs in the birth canal during the transition from intrauterine unconsciousness to extrauterine awareness. Success with this technique has been variable, although a recent survey found faster recoveries in foals receiving the squeeze procedure. If there are signs of gastrointestinal dysfunction, enteral feeding is unlikely to be tolerated, thus parenteral feeding may be required. Although an healthy foal drinks an amount of milk corresponding to 20-30% of its body weight, for a sick foal 10% is enough. Hypothermia is an intervention that in human infants shown to reduce death and disabilities, and it is considered the standard of care. Indeed, actively warming these foals can make the situation get worse. Many owners see foals cold and try to actively heat them up, but this will cause vasodilation and aggravates perfusional issues that the foal has already. The prognosis of foals with Neonatal Maladjustment Syndrome is fair good. The recovery is complete and can be reached in a variable period of time depending on the severity. Prognosis is poorer if there is concurrent sepsis. Also, the use of inotropes has been associated with decreased survival, as if there is need for their use means that the foal is severely compromised. Foals with mild signs can be managed in the field, especially if the owner has enough time. But when foals are recumbent, there is suspicion of sepsis or development of seizures, referral is indicated. What can be done prior to referral? Well, if the foal is dehydrated, administration of fluids will be useful. If there is hypoglycemia, glucose infusion can be used, but it's better to avoid boluses as hyperglycemia can be worse than hypoglycemia. As previously said, these foals are at risk of infection, so antimicrobials can be used, but prior to the administration, consider renal function, especially in dehydrated animals. Okay, that's all. I hope that it was clear. If you liked the video, press like. If you have any question, just comment the video and subscribe to the channel if you want to watch more videos. Bye!